Well, I am so excited that you are all here today. I'm Katie. I'm going to help moderate our conversation. And I work for an organization called Live and Work in Maine. And I grew up in Maine myself, Western Maine. Has anyone been to the Freiburg Fair? Maybe. Okay, so I'm from out that way. And when I grew up and went to high school, I had no idea what I wanted to do. My mom was a nurse. My father worked in the Forest Service, and that's really all that I knew. So I was like, oh, I think I want to go into nursing. And luckily, I was able to get a job in high school at the local hospital. I did registration, so when you walk in to see your doctor, the front desk, I worked there, and then I was able to also work in the emergency room and help get every patient's insurance, and I got to see some surgeries and stuff too. So I got to start my career when I was like 16 and 17 working in a hospital. So we'll talk about this later. I'll tell you all about different potential jobs that you could do even in high school or right when you graduate, if it's something that you wanted to start getting your feet wet in before you really figure out what you want to do long term. So today we're going to talk with these three amazing people who work in healthcare. I will introduce them, but I really want you to be able to ask any questions that you might have, and no question is silly. We were all talking about this before you walked in. We had no idea what we wanted to be when we were in high school, and so having people like us be able to come in and talk to you, we're just trying to help with storytelling and let you know what's here and especially what's going on in Maine as well. So there's so many opportunities. So we'll get into all of that. So today we have Ross Stevenson, who's at the end of the table. He is a CNA, a certified nursing assistant right now at Maine Medical Center. And then we have Lydia Cody, who's a physical therapist at Northern Light Home Care and Hospice. And then we have Brian Sadowski, respiratory therapist at Northern Light Mercy Hospital. And they've all had a few other jobs as well leading up to what they're doing now, so we'll talk about that. So without further ado, Ross, I will throw it over to you to talk about your life and your career and how you are. How are you here today?
All right, sounds good. My name's Ross. I am a certified nursing assistant at Maine Medical Center, and I started working there about a year and a half ago. And what my job entails is, so basically what I do is I am helping the patient at the most basic level. So helping them get up, move around in bed, getting them to and from any scans or x-rays, surgeries that they might have, help them prepare for that. I also help them use the bathroom. I help them order meals. I can help feed them. Can help bathe them with anything that they might need. I'm also kind of like a food runner too. We have snacks and stuff and drinks up on the unit that we run around and grab for people, and just kind of helping out wherever we can. If it's slow, we restock stuff. Just kind of anywhere here and there that we can help out. So how I got to where I'm at right now is I grew up in Minnesota, and when I was in high school, I was thinking about the healthcare field. As a kid, I had always liked the sciences. They had always appealed to me. They were always the most interesting. Everything else was just kind of whatever. But so when high school, I wasn't sure what I wanted to do in healthcare. I knew that I really, really enjoyed it, but I wasn't sure where to go. And my first thing that came to mind was nursing, because it's pretty popular and a lot of people that I know had done it. And one of the things that for my nursing school that they required was to get your CNA certificate. So I ended up getting that in Minnesota, and while I was getting my CNA certificate, I actually kind of changed my mind. I didn't really want to do nursing anymore, and I shifted towards wanting to become a physician assistant. So luckily, I was able to still use the CNA certificate to get to where I wanted to go. So I got my first job at a nursing home in Minnesota where I worked for 2 years. It was really fun time there. I worked during school, and I ended up working every other weekend. So only 16 hours every 2 weeks, which isn't too much, but it was the perfect amount for college. And after I graduated college, I decided to move to Maine with my partner, and we wanted to both pursue our education goals, so that's why we came here. And I was able to get my job at Maine Medical Center on the general surgery unit, which I absolutely love. And like I said, I've been working there for a year and a half. It's a lot different than the nursing home, but it's very fast-paced sometimes, and it can be very slow-paced sometimes, just like any job. But it always keeps you on your toes, so that's one of the things I definitely enjoy about it. Some of the things that I really enjoy about my job is, like I just said, you're always on your toes, so there's always something going on. You're always moving around on your feet. You're not stationary for more than a couple minutes at a time, and I'm a very active person. I can't sit still for very long, so that's one of the perks that I really, really like about the job. I also really like getting to meet so many new people every day. There's so many people that come in and out of the hospital with varying amounts of injury or illness, and it's always nice for me to have a new day at work every day. It's never the same thing. So if you're a type of person that doesn't really like staring at the same thing all the time or going through the same motions, the CNA role is definitely something that you might want to consider. And another thing is the work environment. In healthcare, we're all one big team. So everyone is very cooperative and willing to work with one another. And it's just great because you get to meet all these like-minded people, and no matter how difficult the day is, everyone knows that we got to get our stuff done, and if we work together, the easier it's going to be. So those are just a couple things that I really enjoy about working as a CNA. So what can this do for young people, especially people in high school? The CNA role is a great starting point for anyone that I feel like wants to consider healthcare. A CNA can work in a variety of different environments, so they can work in a hospital and they can also work at a nursing home, and I'm unsure if they can work in hospice or not, but that'd be a good thing to research. So like I had said before, the nursing home role is a little bit different than the hospital role. In the nursing home, it's a little bit more routine. You see the same people more often because they live there, and they're spending most of their time there. And it's just operates a little bit differently. You're not doing so much medical stuff. You're more so kind of tending to their comforts and their meal schedule and their bathing schedule and things like that. In the hospital, it's more so keeping them comfortable, keeping them safe and alive. And you are working more directly with the nurse as like kind of a duo, more so than by yourself. In the nursing home, there's not too much coordinating that you need to do with the nurse unless something's wrong or out of the usual. But in the hospital, there's so many things that we keep track of that we communicate with the nurses just about every hour, if not more, based on how a patient's feeling, what kind of their vital signs are like, if they're going somewhere, if something changes, etc. So what is needed to become a CNA in Maine is that you need to be 16 years old, which most of you are or will be. You need to at least complete a 9th grade, so you don't need a high school diploma for it. So you guys can start working in the field right now if you wanted to. And what else do you need? The training course is 180 hours, so courses mostly range from like 5 to 8 weeks or so. It might be a little longer depending on what program you do and how many hours per week. And like I said, you can do all of this in high school. You could do it over the summer, which is what I did, which was really helpful. And then you could start working in the summer. And a lot of healthcare jobs are very, very flexible with scheduling because hospitals and nursing homes are 24/7. So if you find yourself out of high school and you're a night owl, you can work nights. If you want to rotate, you can do some days, some nights. There's so many different available shifts and positions that you can kind of go into any little part you want to, which is a really good part, especially for me because I never want to work nights ever. That's just me, but it's available to work only during the day, which is perfect for me. And I think it's also a great icebreaker for the healthcare field. It gets your toes wet in just about everything. You get to see and observe so much as a CNA that you can watch the doctors and the other providers come in. You can see the respiratory therapists come in and work with your patients. You can see physical therapy come in and work with your patients. And there's so many moving parts in the hospital that you don't really realize until you spend quite a bit of time there, that it's really, really interesting. And you get to find out pretty quickly what you like and what you don't like. So some things that are definitely helpful in the healthcare field if you want to pursue this role is that you have to be able to be on your feet for quite a while. You do get some breaks. Some days are slower or faster than others, but being on your feet and being able to help patients move, so being able to lift a bit of weight and help them mobilize is very important. Being able to multitask is also very important, and to have kind of some good short-term memory because so many things can kind of get thrown at you at once, that being able to keep things fresh in your mind is pretty helpful until you can get to a computer and document all of it. Another thing is having good bedside manner. So what that means is being able to talk with someone one-on-one, a patient, without sounding rude, sounding mean, being condescending. That's very important because when someone's in the hospital, they really want to feel comfortable because they're at some of the lowest parts of their life. Like they are injured, they're sick. Nobody wants to be at the hospital. So being able to make them feel welcome, feel comfortable, feeling like they're able to talk to you and have their needs met and have their opinions validated is so important. So that is very key in the role of a CNA. And let's see, sorry, I lost track here a little bit. So things that you can do after getting your CNA certificate is just about anything. It's an amazing prerequisite. Some schools, like physician assistant school, is what I'm pursuing. So certain schools require certain amounts of direct patient interaction. So that means having hands-on time with the patient, and the CNA role does just that. So you can fulfill those hours with this job, and you are able to switch departments too if you wanted. So I work on a general surgery unit right now, and if I wanted to, I could switch jobs and go to a cardiac floor, so heart monitoring and stuff like that, or people with brain injuries or spinal injuries, or you can really have the freedom to move around wherever you want, which is also really nice. So if I had some advice for my high school self, if I were to go back and tell myself, I would say a couple things. Probably it's okay to not know what you want to do. Don't panic. You have a lot of time, and even if you don't like what you pursue the first time around, there's always more chances to. So don't feel like your one selection has to be the one that you stick with forever. And another thing would be it's really important to focus in the classes that you're in right now, that you like, and I should say all of them, but getting the base knowledge for the classes that you intend to pursue is so important, because the more solid foundation you have in those classes now, it's going to be that much easier when you get up to the higher level classes to just advance much more quickly, and it'll all come to you much faster. So, I miss anything?
I don't think so. That is such a great comprehensive overview of everything that you said. Do you want to talk briefly about, I guess you are pursuing the physician assistant pathway, which is now that you've been in the workforce for a few years doing the CNA, as you mentioned, it was a good starting point. Do you want to just speak briefly about what does a PA do, and why you're excited about that?
Yeah, so a physician assistant is a medical provider, so they are on the same level as doctors and nurse practitioners. Instead of 4 years of schooling and then 4 years of residency like a doctor is, a physician assistant is only a 2-year program, which is what makes it so appealing, and that's also why I want to do it, is because you have the level of a provider where you can diagnose, you can order imaging, you can treat people, you can prescribe medications, you can give injections, all that good stuff that a doctor can do, but it's a lot shorter of a time span of education. And you are able to work alongside physicians and nurse practitioners. There are a few limitations. You can't lead surgery, you can assist in surgery. And what else? Not much. There's really not many limitations, which is the best part about it. So the only PA school in Maine is at University of New England. Hopefully a few more open up. There is a couple throughout New England, and especially in Massachusetts, there are some. But depending on the school you go to, it could be 2 to 3 years. But like I said, there's not really that many differences between that and doctors. And the occupation has really been increasing in popularity, and schools have been kind of struggling to keep up in advancing their class size and the schools themselves. So it's very competitive right now, but if you guys have any interest in looking into it, I would absolutely recommend it.
And I think it's great that you were able to get so much experience as a CNA leading up to this. So you're going to be such a good provider by the time you're done with school. And I just wanted to speak quickly on, so Ross mentioned that you could take this summer, or during, maybe there's a program after school if you wanted to get your CNA training. A lot of places in Maine, and specifically at Maine Med right now, they're paying for you to take the course, and then you would pretty much be guaranteed to have if you passed all the exams, you'd be pretty much guaranteed a CNA role after that. But there's so many incentives and opportunities right now in Maine because they want people to take these jobs. So it's not like you'd have to forego making money while you're in the course. They will actually pay you an hourly rate. Mm-hmm. So I think that's excellent. So you won't lose time.
Yeah.
So thank you so much, Ross.
Yeah.
Does anyone have questions for Ross? We will specifically ask him questions right now. But of course, if you don't have a question now but want to ask him something at the end of the conversation, you can do that then. So do we have any questions for Ross? Ashley in the back, what's your question?
I wanted to know, how do you think being a CNA has led to you feeling confident in your decision to become a PA?
Ooh, that's a good one. I'd say that being able to, for me, when I haven't done something before, the first time I do something, I'm very nervous. Even if it seems familiar in my head, just the way of going about doing something for the first time just makes me nervous. And being able to work in a hospital, you have so many medical firsts, so to speak. The first time I ever got someone's blood sugar, you have one of those little lancets that you poke someone's finger with to get a drop of blood. My hands would not stop shaking. I almost missed their finger. But since then, I am extremely comfortable with it. I got my own routine. It's like clockwork. So just being able to expose myself and do things for the first time, getting myself out of that comfort zone has really helped me learn that, doing something for the first time doesn't have to be as nerve-wracking as it actually is. So having my confidence boosted and becoming familiar with a lot of medical terms and procedures has helped a ton.
What about the exposure of the other careers? Did it allow you to get exposed to just other careers you may not have known about?
Oh, yeah.
Yeah, what's something at a hospital that you didn't even, or it could be at the hospital, it could be on the floor you're on, or even at the nursing home. Like, what are roles that you didn't even know existed before?
Some roles that I didn't know existed. Spiritual care. Spiritual care is pretty present in the hospital. It's not more so a healthcare specific field, but chaplains and priests are able to come in and just help people out if they feel like they want to spend some time with one of those people. We have those people on site. Respiratory therapy is one that I didn't know until, I knew of it, but I was just like, I wonder what they do exactly.
Which we will learn about.
Which they do a lot. They are lifesavers, literally and figuratively. So, what other positions?
Anesthesia.
Oh, yeah. I don't really interact with anesthesia all that often, but that is one that they have their own little section going on downstairs. But, yeah, they help everything, bring people down to the operating room if they want to. They have assistants down there that help out any way they can, and anesthesia's got their own little bag of treats that they have. So
there's so many jobs with different skill sets needed, but I think starting with you and hearing what a CNA, you really get in with the patients and help them so much. So I think it's such a good learning. Mm-hmm. Awesome. Thank you, Ross. We're going to move on to Lydia.
Got one question?
Yeah, the question.
Oh, I'm so sorry. I'm sorry, Jack.
So, in your time, have you observed the effectiveness of, say, general medical diagnostic technology?
Most of the equipment that I interact with, as far as diagnostic equipment goes, portable X-ray machines, super cool, super clunky though. They're huge, but they come right to the bedside and they can do a chest X-ray and they can see if you have pneumonia. They can see if you got broken ribs. They can see if you got all sorts of fluid in your lungs, fluid around your lungs, fluid around your heart. Bunch of really cool stuff. Lab also comes through, so people come through and draw blood all the time, and they send it back, and the nurses and I are able to look at the results, and they can see, oh, this is low, so they need this and this. And respiratory therapy comes through and does some good listens and says, oh, their lungs sound like junk, so we got to do this. And other than that, not too much on my end as far as diagnostic equipment, but that's the extent that I get exposed to, yeah. Mm-hmm.
Any other questions? Otherwise, we can move on to Lydia. All right, I'll pass it over to you, Lydia. Tell us about you. And
I'm a
your
physical
work.
therapist. I currently work at Northern Light Home Care and Hospice. I've been doing that for the past 4 years. If somebody told me when I was in high school that I would be a physical therapist, I wouldn't have believed them. That was not even on my radar of what is physical therapy. I don't even know what that is. I knew I was definitely interested in the healthcare field. Like Ross said, I loved my science classes. I loved dissecting the frogs, and I thought that was really fun and cool. And so I was very interested in that and helping people. I wanted to help people, but I didn't really know kind of how or what I wanted to do. I had some death and different things happen when I was in high school, and so I thought, oh, maybe I'll be a social worker. I'll help people that way and get into social work and kind of be a counselor. I can kind of empathize with that, understand. So I went to a local community college because I still wasn't sure if that's exactly what I wanted to do. So I didn't want to commit to a big school and pay a lot of money to not know what I wanted to do. So I took some psychology classes and sociology classes and learned more about it and realized this is not really for me kind of long term. I kind of wanted more of that medical. I was really looking more at that medical aspect, hence that, the frog dissection kind of thing was cool. So again, I didn't really know or have somebody to kind of guide me into what field would be of interest to me, and nursing was a big thing. Like you had said earlier, everyone was going to be a nurse. It was, the thing to kind of do. So I thought, okay, I'll apply to the nursing program. So I did that at USM, and at the time there was a wait list because everyone wanted to be a nurse. So I was kind of guided to, all right, finish your core classes. You still have to take your English and your math and, those psychology, anatomy and physiology, those kind of classes, prerequisite classes. So I did that, and I was still waiting. And I thought, well, if I don't keep going to school, or if I get a job and I'm going to just start working and not go back to school, and I was kind of afraid I was going to do that. So I found a medical assisting certificate. So it's a 9-month program. I did it at Seacoast Career Schools in Sanford, Maine. And it's kind of like a couple steps down from being a nurse in a sense. So you're the person who, when you go to the doctor's office for just a regular physical, I check you in the door, I take your blood pressure, I, check your weight, I can give you a shot if you need like the flu shot or if you need some kind of other shot. I can draw your blood. So doing all those different kind of things. So I got my medical assisting certificate, started working at a doctor's office, and I enjoyed it. That's exactly what I did, was checking people into the rooms, making phone calls to pharmacies to make sure that they're getting their medication that the doctor's prescribing, those different kinds of things. And at the same time, I was working part-time at a local gym where I grew up, just teaching people how to use gym equipment. I was very active. I was an athlete all through school. I really enjoyed, working out. So, and while I was going to medical assisting school, that's kind of what I did. I was that gym assistant, kind of showing people how to use gym equipment. And it wasn't just a gym, it was a physical therapy clinic, an outpatient physical therapy clinic. So I found myself, when I didn't have somebody to show the gym equipment to, found myself kind of looking over, what are those PTs doing? What are they look like they're kind of having fun. They're showing people how to do exercises. They're doing different things with them. Like, that looks kind of cool. And I slowly kind of made my way, hey, you need any help over there? You need help with something? So I would help. I kind of transitioned into being a physical therapy aide. So that's on the job training. So you can kind of apply and go to I think in the hospital they have aides. I don't know if you guys know that or not, but they have physical therapy aides in the hospital. They have a lot of them in the outpatient kind of clinics. And you basically set up the rooms for them, bring them different equipment that they might need for the patient. You can kind of, when the patient first comes in, you can make sure they're scheduled for their next session, kind of get the paperwork ready. It was just a way to learn more about, what physical therapy was, what they were kind of doing with the patients. And I really enjoyed that. Actually, I enjoyed that more, going to work there more than I did going and being a medical assistant. I liked it, but I wasn't like super passionate about it. So one of the PTs pulled me aside and said, hey, I think you should consider PT school. Like, you should go to PT school. I think you'd be a good PT. And I laughed at him. I said, no. That's too much schooling. I'm not smart enough for that. I can't do that. No, I think I'm going to just stay on this nursing path. And he said, well, that's fine, but I think you should, consider it. I, at the time, did not have the confidence that I could do that. When I was in high school, academics was not on the top of my list. I played sports. I wanted to hang out with my friends. I, I didn't get the greatest of grades. I didn't care that much about it. So, thinking, oh, the PT school it's pretty intense. I know you have to maintain a certain GPA. It's a lot of work. I don't know if I'm cut out for that and I can do that. So it was probably a good couple months at least from what I can recall. And he brought it up again and said, well, why don't you just apply? See if you get in, just apply. The other thing was PT school. So most schools are 6 to 7 year program. In Maine, there's UNE, University of New England, and then there's Husson University, which is in Bangor. So Husson, I don't know UNE's program exactly, but Husson's program is a 6-year program. So you do 4 years, you get your bachelor's in kinesiology, which is exercise science and movement, and then 2 years to get your doctorates. So which is the highest level of physical therapy that you can get. Oh, where was I going with this? So I knew that was a lot of schooling. That was, I got my core classes, but I still had, a good 4 or 5 years, left of schooling. And financially, my family couldn't afford to pay, for me to, and I said, well, what am I going to do? I don't know if I can do this. I already have paid to get my medical assisting. I just started working. I haven't even paid that off. So I applied for financial aid, which most people do. And so I got the financial aid. I ended up getting into the program and I said, okay, well, I guess I'm going to do this. So I kind of started as a transitional student. So I didn't start right as a freshman in college because I had those core classes at the community colleges that I went to transfer. So I believe if you go to school at a community college in Maine, a lot of those classes can be transferred to USM, to Husson, to UNE. So that's really nice too, because from a financial standpoint, and if you're not sure exactly what you want to do, those classes can be transferred and you don't have to retake them, which is nice.
And right now, Maine still has 2 years of free community college.
Yeah, that's amazing. I wish I had that.
For seniors to know that. I know, and I think it will continue on. So
Yeah.
just something to keep in the back of your head, money-wise. Yep. Keep going. Sorry.
So, again, PT school. So you get your doctorates of physical therapy. It used to be bachelor's, then it was master's. Now I don't think there's any school that doesn't require a doctorates. So that's what you get as your doctorates. And for Husson, we had to maintain a certain, GPA. You have clinicals that you have to do, which are really cool. So those are actually going out into the clinics, like the one that I worked in, and practicing being a PT. Working under the PT, they kind of help you and show you what to do, but you kind of practice an evaluation. You practice seeing somebody that's been hurt and saying, well, what's kind of going on? How can I help you? Figuring out maybe what's going on with them. So for Husson, there's 4 clinical rotations that you have to do. So they're 2 months long and they're kind of in between your schooling, which is kind of nice. So it kind of breaks that up a little bit. And you have to go to different settings. So the cool thing about being a PT is, like Ross said, there are different avenues, different places you can be a PT. You can work in a hospital. You can work in a nursing home. You can work what I do in home health. So you go to somebody's home and you see them in their home. You can do it at an outpatient clinic. So you want to do sports therapy, you can, do it that way. Some people work for, professional sports. That's kind of, that's a specialty that's rare, but you can do all different, you can work in a school and you can be a pediatric PT. So there's all these different settings and they force us to go to these different ones to get an idea of, what we might be interested in and be a little more well-rounded. So, part of that is if 6-year program and, all that schooling is kind of a little bit overwhelming or a little bit too much, and you're like, oh, I don't know if I want to do that, you can also be a physical therapy assistant. So that is a 2-year program. And in Maine right now, there's, I believe, only one school. It's called Kennebec Valley, and that's in Fairfield. And so the difference between a PT and a PTA is the PT is the one who does the evaluation. So say you were going for a walk outside and you tripped over the sidewalk or something happened and you kind of potentially sprain your ankle or hurt your ankle and you're limping around, you can't walk really good, it hurts a lot, it's swollen. What the heck did I do to my ankle? Right? So you might go to a doctor, or you might be able to go, depending on what insurance you have, you might be able to go right to the physical therapy clinic and say, hey, can you figure out what's wrong with my ankle and help me out? So that's where the physical therapist does the evaluation and says, oh, you sprained this ligament, or you tore, this ligament, and that's why you're having this pain, that's why you're having this swelling. Here, let's make a plan of care. Let's make a kind of goals on how to help you get better, how to get rid of that pain, how to help you be able to, walk again without limping or without having to use crutches. So they kind of diagnose and figure out what's going on and make a treatment plan. And then the physical therapy assistant is the one who kind of can carry out that plan. So can do the exercises, can do some of that treatment to help. So they can't diagnose, they can't do that initial evaluation. And then if it's been about 30 days that you've been having therapy, or if the physical therapist has seen them for 10 visits, or it's been 30 days, we have to come back in and reevaluate them and say, kind of review the physical therapist assistant's chart, make sure they're doing, as we directed, and kind of review, okay, you're doing better. You're kind of almost there, and either continue to see them or discharge them. So we have a lot more paperwork. We have a lot more kind of responsibility on our plate of figuring out what's going on and what we need to do versus the PTA, but there's those options. So there's physical therapist, a physical therapist assistant, and then you can also, a great starting point is a physical therapy aide. So kind of working in that clinic and kind of getting to know, what a PT, and a lot of times we work together. So most PT clinics, PT places have physical therapists and have physical therapy assistants, which is nice.
When you were in your clinical, how did you decide? Because now you're in home, you're traveling to people's homes. So had you worked in a facility at one point, or worked with older people and then realized, I think I want to do?
Yeah. So
how did you make that decision?
Yeah. So, when I was in college, I thought I wanted to work in outpatient sport. I really liked sports. I really liked helping people that way. I want to work in an outpatient sports clinic. That's what I'm going to do. That never happened. I have yet to have a job in an outpatient clinic. So I actually started, when I graduated, I did travel physical therapy. So you can do travel PT, and I traveled way up north, basically the Canadian border almost, in Fort Kent, Maine. And I worked in a nursing home there. So I worked with older people, and French was their first language, and that was that was a bit tough. But yeah, and then I surprised myself again by getting into working. I did work in an outpatient clinic, but it was brain injury specifically. So it was anybody that had a concussion or a brain tumor or a stroke or anything like that. So it was all brain injury related. And I really liked that. In school, I would have never thought I would have done that either. That terrified me. That was like too challenging. I don't know if I can do that. So it's been really interesting to watch myself kind of grow into these different fields and settings and learn more and challenge myself.
How did you get the confidence? Because I remember being in a high school girl and thinking, oh, I can't do that. I'm not smart enough to do that. How'd you get there?
Well, I think a big part of it, like I said, was these mentors that I have. They were the ones that really kind of pushed me and said, no, you can. They saw my potential before I saw it. And then once I got into school and started getting good grades and started, really understanding and doing a good job, because I cared about it. I wanted to do it. I knew sort of what the end goal was going to be. And so, I was passionate about it. I really liked it. Yeah.
You don't have to be perfect grades, perfect anything.
My grades are terrible.
We all figure it out. We're all human, and there's different iterations of us. There's things you don't even know that you're good at yet that you will be eventually.
Yeah.
Sorry if I interrupted your story. I didn't know if you had anything else to say or if anyone had questions. Sure.
So, in your time as a physical therapist, you said that you would have to diagnose people.
Mm-hmm.
Would that involve using diagnostic technology?
No.
Also, for your time at the outpatient, I believe you said, how would you effectively treat someone with, say, a brain tumor?
So I wouldn't treat per se the brain tumor, right? That's the condition that they have, but because of that can be affecting, depending on where it is in their brain, that can affect their balance, that can affect how they walk, that can affect their strength, so they could be weaker. So we do a lot of different things on building people's strength, working on their balance and their coordination so they don't fall as much, or so they're not as unsteady. So those kind of things. We kind of treat the symptoms around the brain tumor, or, if they had a stroke and it damaged a certain part of their brain. Yeah. Does that answer your question?
More or less.
Yeah. Thanks.
Anyone else have questions? And how do you mentioned you weren't super, this is kind of putting you on the spot, but you said you weren't as passionate about the medical assistant, which totally fine. We all have different passions. How do you think, was it just trial and error to figure out what you were passionate about? How did you divert?
Definitely. I think if I didn't have that PT clinic to work in, I probably still would have gone that nursing path. I just found myself really enjoying going to work and learning from those PTs and really liking that more exercise kind of based treatment approach versus drawing somebody's blood or giving them shots, which is fine. That's great if you love that, but that's, yeah.
I mean, some people love the science, like with the surgery and getting in there and seeing what's happening, physically seeing what's happening inside, and then you're helping people get their movement back. I mean, I've had to, even as a young person, I've had to go to physical therapy a bunch of times because I hurt my shoulders. I fell on my knee skiing, and I had to have a surgery when I was 22, and a physical therapist got me walking again.
Yeah,
so.
And we have, especially in home health, we have different things we can do as physical therapists. I remove staples. I can do what's called an INR. So it's kind of like a blood sugar check, a little finger check to see how thin or thick your blood is. So we kind of have that medical aspect too, which I really like. So,
Sometimes you're seeing people right after surgery.
Oh, yes.
Getting them moving.
Yep. We work very closely with CNAs if you're working in a hospital, or, oh my goodness, we love you guys. We depend on you a lot for help and, so, yeah. And respiratory therapists as well in hospital settings, yep.
See how it's all connected. Everyone's working together in different fields. So, but you can see how it might be tricky to be like, well, which one do I like? Which one do I like more? What would I be good at? So, does anyone else have a question? Otherwise, we're going to move on to Brian.
What's the best part of your job?
Oh, what's the
best part of my job? I love getting people back to doing what they love to do. So, like right now in my home health setting, if I'm going out to see someone and they say, I just want to be able to garden again. I just want to be able to get out and walk out to my garden and kneel down and not be afraid that I'm going to fall over and break my leg. And to be able to give them the confidence and the strength and the balance to be able to do that is, I love that. I love giving people their life back in a way. Yeah.
That's good. That's such a good question. Great. All right, Brian, we'll go to you. Tell us about respiratory therapy. It sounds like a lot of us don't know a ton about it.
No, and a lot of people don't. My name is Brian, respiratory therapist at Northern Light Mercy Hospital. What does that really mean? As a respiratory therapist, we administer oxygen to patients. We administer medicines that go to the lungs. We administer lung functions for patients to diagnose them for lung disease. We don't actually diagnose them per se. We do the testing, and the physician diagnoses them with the results. We also take care of patients on mechanical ventilators, as you might have probably seen over the last couple of years on TVs, or listening to stories where hospitals don't have ventilators to keep people alive. So we manage those ventilators that keep people alive when they can't breathe on their own. And we put them on ventilators so they can heal, and gives us time to find out what's going wrong with them, get them better, and then eventually come off the ventilator. And other disciplines like physical therapy will come in, CNA will come in to exercise them, because when you're on a ventilator, your body's, you're laying in bed, you're not moving, so your muscles get kind of relaxed. So when you come off a ventilator, you got to get those systems going again to keep the patient going and get them better and progress as they go along. So I guess, how did I get to this point in my career? To be a respiratory therapist, it's a 2-year program. There is 2 schools in the state of Maine that have this degree. One of them is in South Portland at SMCC, and up in Fairfield is the Kennebec Valley Community College. So with those 2 years, you pretty much go straight through, even through your summers. So you start in your freshman year in the fall, you go through the first summer, and then your second year, again, you're going straight through until you graduate in 2 years. How did I find myself in the healthcare field? It was kind of interesting, kind of like in your shoes right now, where when I was in high school, I had some friends talk to me about being an emergency medical technician, an EMT. So I looked into it, found out what it was about, got my EMT license at the age of 15. I was a volunteer EMT at a local ambulance company town that I lived in. Went on a few calls, wanted to see if I liked it or not, to go to these emergencies where people call 911. You get a variety of problems. And I learned a lot, learned quite a bit. And I kind of enjoyed it. That might sound kind of weird, but it was interesting to see the variety of calls that you get for a 911 system, whether it be a sprained ankle, a broken leg, somebody who can't breathe, somebody's having a heart attack. You get a variety of situations where you go there, you take care of the patient, you treat them, and get them to the hospital as quick as you can for a higher level of care.
And how long did that course take? Do you remember how long it was?
That's what I was thinking.
Okay.
I want to say it's either 3 or 5 months.
Which you can do now. You can do that.
You
You can do EMT
certainly
now.
Absolutely. I don't know up here for schools. I grew up in Connecticut, so I don't know what schools they have up here for that. But I'm sure, we could probably get some information if you're looking to do that route.
There's definitely a lot of trainings for the EMT, that I know.
Yeah.
So we can make sure you have it.
And even if you don't want to do the EMT route, I mean, right now, if you just want to dabble into the healthcare field, get your BLS card, your basic life support card. Take a course. It might be a weekend course. It might be a week course. And that will give you kind of a feel of doing CPR and kind of start there, what you can do now too. Which, if you go in the medical field, you're going to need that certificate anyways. So it's good to get it now. And then you can just keep it as you go along through your schooling.
You said you were good, or you liked all the emergencies. It seems like you're probably cool and calm under pressure.
You have to be.
Okay, so that's got to be a good qualifier.
Yeah, and yeah, I mean, there's situations where you've never seen. I mean, at 15 years old, haven't seen anything, and you're so exposed, and you'll be afraid if you go that route into the emergency medical field, because you'll see stuff that's pretty gross. You'll see stuff that's pretty rewarding. Yeah, and I was a busybody person. I didn't like to sit around and stay home, and I was active in sports as well. So it was a great introduction for me to find out what I wanted to do. But while I was going to high school, or going to doing this EMT class in high school, I actually wanted to be an electrician, kind of opposite ends of the field. So I went to a vocational technical school in Connecticut, did my 4 years of high school there, got my high school degree, got my diploma in electrical field. And I still didn't know what I wanted to do. Yeah, I had my EMT license for a while, got my degree in high school, and I still didn't know what I wanted to do. So my aunt, who is a nurse for many years, knew me quite well. I knew what I liked to do, what I didn't like to do. And I've always told some stories about how I liked doing the EMS part of it. So she came up to me one day and she goes, "Why don't you be a respiratory therapist?" And as we all kind of say, well, I said, "What is a respiratory therapist?" I just know nursing, I know doctors, I know physical therapists, but I've never heard of respiratory therapy. So she told me about it. I looked into it. In my mind, it was kind of the same pathway in a way of being an EMT, where when you're a respiratory therapist, you're always there in emergency situations. You're in the critical high acuity patients, where it's life and death. You're in the ER, which comes through the door. Could be a variety of problems that come through the door that are breathing related, that we get called down there to help and take care of. So I found all of that stuff from my EMT license pretty interesting, and it related to the respiratory field that I'm in. So that's how I got to be a respiratory therapist.
Are there different levels of respiratory therapy? So I think, so say there's like a level 1, 2, or 3, or what are you doing differently at the levels? Like, is it just because you're learning over time? I think that'd be interesting to know that you could. I asked that because I think it's important to know that you can move up in all of these different jobs.
Yeah. So in most hospitals these days, they have levels of levels for an RT to advance. So when you get out of college and you start into the respiratory therapy field, the hospital hires you on, you start as a level 1 respiratory therapist. Basically out of school, a little knowledge, but yet you know enough, and they put you in that category. As you grow in the field in the hospital, there is certain criteria that is developed for your profession and for your growth through the hospital. So it could be level 1, level 2, level 3. Some hospitals have level 1, level 2, level 3, level 4. It all depends on what the criteria the hospital wants that fits the needs at that point in time. And with those levels come more responsibility. So, if you wanted to stay at level 1, that's fine. If you wanted to progress, you can progress and do more through the hospital, and it's better for you to do that because you'll be exposed to more things, which is great. More knowledge is power. So.
Are you managing people?
Yeah. So. I've been at Mercy since 2010. I was doing some floor therapy as a respiratory therapist for a number of years, and then decided to take the management role. And I've been doing that for the last 6 years. So I kind of understand the business a lot. So in that role, as you get to those levels, you can take over management, you can become management, and then still progress on. With other things you can do with us, there's different licensures that you can get, certificates. So one of the is your BLS, your basic life support. Another one is your advanced cardiac life support license. Basically what that means is if somebody needs advanced life support where they're coming in and they're not breathing at all, and there's no physician around, the next level licensure, if you have that, you can actually run a code. So when somebody's doing CPR and they're not breathing, then you had that licensure, and a provider's not there at the point in time, you can run that code, and you can give off medications, dosages, shocking people, and then when a provider comes, they take over, and then you step back in that role, step back. So you can be a certified or registered pulmonary function technician, where you can do diagnostic testing for asthma or for COPD, emphysema patients, anything lung related. That person will do some testing, breathing testing there. Little babies, you can get your license in neonatal resuscitation. So at a delivery, a baby delivery, if they're not breathing, you'll have that certificate and that level of professionalism that you can take care of that baby when they're not breathing. Or when they're breathing and they need just a little bit more of assistance to breathe, you'll have that knowledge and be able to get that specialty license part of it.
Wow.
Some of the skill sets that we need in our position to kind of do our daily things is, like everybody, you have to know how to run a computer. That's a small part of what we do. Compassionate, detail-oriented, interpersonal skills you need, patience and problem solving. With science, nothing's perfect. When you're taking care of a patient, nothing's perfect. But you know what you have to do, and you know what you're trained to do. But it always doesn't go that way. So you have to step back, think about it, and say, oh, yeah, let's give this a try. Some of the other diagnostic tests that we do is draw blood gases. Like a phlebotomist would draw regular blood from your vein. We actually draw blood from the arteries. That blood from the arteries gives us a great information about how the patient is breathing. So we all have an acid or an alkaline balance in our body, where it could be acidic or non-acidic, or your CO2 levels, your carbon dioxide levels. We measure those because those affect your breathing. Oxygenation we measure, and bicarb, which is an acid-base balance. So all those things play a major role in how we breathe as an individual, as a person. So we do those quite often to make sure we're ventilating or going in the right path with that patient so they can get better. And then currently, I, as well as further my education in my career, I have my associate's degree, but I'm going to get a bachelor's degree in healthcare administration. I just find what I do is interesting, but I want to learn another part of what we do. So hopefully in another year or two, I'll have my bachelor's degree and maybe step back from this role and be like a senior leader and kind of progress people and progress that way. So
That's awesome. And what's your favorite part of your? Oh, I'm stealing Nate's question. What's the best part of your job every day?
It's actually seeing the patient when they come through the ER, and they're in distress. And then when you're actually there that first day to take care of them, and then you're there for 3 days in a row for 12-hour shifts, and you come back and you see them from where they at their worst to where they get better, and they actually leave. And in that between situations, you have that dialogue with that patient, and you can talk to them about where they were and what you did for them and how they are today. So it's kind of neat to see from beginning to end, and it actually makes you feel pretty good.
Oh, I love that you had your story about you got your EMT, you've been doing respiratory therapy, and then the idea that you can, if you wanted to go into management, some people don't want to manage people, and you figure this out as you get older. You're like, maybe I want to do that, or maybe I want to work alone, or maybe I would be okay managing people. But I think the point is, and you've heard it from all three of them, is that if you know you're interested in healthcare, you can just jump around. But there are so many opportunities for you all, right, even starting right now, starting next summer, to just dip your toe into healthcare. You could try these trainings and just see what it's like to work in healthcare. And then some of these programs are longer, but you could also do a quick course, or like this. How long is the CNA program again?
180 hours worth of training, so
Okay.
between 1 and 2 months usually.
Right. Boom. You could do that. That's shorter than a semester course. You don't do semesters. You do semesters? Semester course. Okay. So very quick. But I think that these stories are so interesting to hear all of the different, there's so many different types of jobs out there. Of course, if anyone has questions, let me know, but I'd be curious. Yep, you have a question? Go ahead, sir.
Of course, I have a question, but so you mentioned at one point that as a respiratory therapist, you would tend to do tests to see if they have any, say, lung diseases or anything along that track. So, could you name some things you would need to test for, and then how you might do it, and then the general effectiveness of such tests?
Good question. So, some of the tests that we will do is we would actually also go into the operating room. And then outpatients would come in with lung nodules, which is just spots on their lungs that get identified by x-rays. That could be cancer, could be not cancerous. So they would come in, we would put them in the OR, and we would work with the pulmonologists side by side, literally. They would, put a scope down into their lungs with a camera, look inside, find out where they need to be, and as a respiratory therapist working on the side of them, we will put instruments down the scope to actually biopsy their lung. Grab a piece of tissue, take it out, put it in the lab solution, and then give that to the lab, and then run the tests, and then the doctor has some information if it's cancer, non-cancer, or if it's just something different. So that's one ways.
Cool.
To find it out.
So as we wrap up the last few minutes, you can think of any more questions that you have, but I'm just curious, did you know about these kinds of jobs going into today, or did anyone learn anything new that you want to share? You? And then I'm going to call on you, Asia. Yeah, what did you learn? You can think about it.
So I suppose I learned how it's kind of fluid when you get into the medical industry. I think you've all at one point referenced how you wanted to do one thing, and people told you should kind of investigate another thing, and then you're basically just jumping from thing to thing to thing. Mm-hmm. Would you say perhaps that changes when you get to say things that take longer to study, take oncology or being a dentist, for example? Would you say that's less fluid and more rigid?
That's a good question.
Yeah, I don't know all too much about the other occupations, but as you get, there's so many roles within healthcare that there are plenty of advanced roles, and there's also plenty of basic roles. I'm not too familiar with all the more advanced roles, but there's so many steps that you can take to get to the advanced roles. But as for bouncing around when you're in an advanced role, I think it's more so the setting that you would bounce around with. So instead of working at an outpatient clinic as a doctor, you could go work at a super rural hospital where there's not many staff, or else you could go work at Maine Med or Mercy, which are both pretty big. So I would say more so the setting than the role when you're in those advanced positions.
Yeah, because you can, oncology, right? That's a specialty. So that's an interest in, cancer. So, yeah, you can change the setting in, or area, but still kind of having that passion for oncology and wanting to advance yourself in that. I mean, you can get different specialties in multiple different as a PT, you can get a cardiac, oncology, neurology. You can get all of those. It's a lot more work and it's a lot more kind of time, but you can specialize in multiple. But most people kind of pick sort of one or two thing that they're really, really interested in. And they kind of specialize in that. They don't bounce around so much. That way.
I think starting out, it's okay to bounce around a bit.
Yeah,
like
you figure out
what you want to do.
you're interested in.
And then you might hone in on something a little bit more specific, or not to steal the PA story, but I have one of my best friends. She was a CNA as well, then went to did the physician assistant program, and she was really fast paced. She ended up working up in Skowhegan at the emergency room. So really crazy hours, longer shifts, 12-hour shifts, but she loved it. She loved the medicine. She loved how fast paced it was. She did that for 6 or 7 years, and then she had her first baby, and she wanted something that kind of slowed down. So she ended up working a more 9-to-5 job in pain management. And so she didn't have those crazy hours anymore, and eventually down the line, she said she could go work at another hospital, or she could work, you can work in a dermatology office. But her specialty was physician assistant, but she was able to really just change up what she did depending on her lifestyle, which I think healthcare, life changes. So it's good that you can just kind of have that flexibility.
Yeah, lots of opportunities.
Yeah. Any other questions or things you learned today that you want to talk about? Otherwise, we can shut the camera off and say thank you to our panelists. Thank you so much, everyone, for coming today, and for the students for being here. This was so fun. And
Are you guys planning on staying in Maine after graduation, or we're not biased? I'm just starting.
yeah, we're just curious what you're thinking.
I probably want to head to Massachusetts.
Yeah?
If I can hack it, there's a lot of opportunities there. Like, take MIT, for example.
Very
It's
cool.
one, if I could hack it, mind you, there's no guarantee that I would be able to make it there, but
Worth a
Are you
shot.
guys all pretty committed to healthcare, or are you still deciding?
Yeah, what do you do? Are you on the fence, or what are you thinking, Asia?
I've always been into healthcare since I was really little, so I feel like it's just something that I kind of have to figure out what I want to do. I know it's definitely healthcare, but just what path now I have to decide.
Cool. So is this kind of thing helpful? Is this this storytelling? Is this helpful? Is there something that you would have liked to see different?
I kind of came here more for specific,
Yeah, you have a niche. You have a niche, right?
Good niche, though.
hoping to find stuff in diagnostic technologies.
Yeah.
Personally, I mean, that's very, very, very specific and specialized knowledge. Didn't really come here expecting to find much about it,
But there are a lot of diagnostics. There are a ton of companies in Maine that do that. So I think it's more just figuring
I would reach
out.
out to those.
The one I'm looking into would be a bit more specialized because basically involves detecting electrical fields and then aligning that against a blueprint of sorts. So basically aligning the electrical field of where a particle is to where it should be.
Yeah,
Essentially.
that's over my head. So
Yeah. So you can go into medical sales. I have some colleagues that either start where we are and then want to go into medical sales, where they can get into selling MRI units, or you can sell.
I wouldn't be selling. I'd be more into making.
Making.
Yeah, maybe some research and technology. Yeah,
Medical research, medical engineering.
And UMaine has a great, and they're an R1 research institute now. They got that designation, which is a big deal for Maine. So it's the number one rating, R1. UMaine has the biomedical engineering degree.
I was going to say clinical engineering.
Clinical engineering, biomedical engineering.
Same thing.
So
UMaine or no.
UMaine biomedical engineering.
Yeah.
And I'd say if there's something that you're kind of interested in, this might, reach out to somebody if you know of somebody, or somebody that's a therapist or a doctor, or, try to connect with someone and learn more about it, because you might think you really like it, and then you go and job shadow if you can or something like that, and you're like, well, no, that wasn't what I thought.
Right.
But that's what happened with me.
So many companies, though, to your point, Lydia, is that people it's usually somebody in human resources, HR, or in hiring. They would love to have a young person come in and shadow. And so if you're feeling confident and you want to do a little research on your own, you could reach out and just tell different companies that you're interested in learning more, and they might let you in.